Hello everyone, my name is Danielle Feliciano, and I will be doing my report on health disparities and inequities. First off, what is a health disparity? Health disparity is defined as the difference in health between two populations, often caused by two health inequalities. These inequalities being lack of access to care and lack of quality care. Health disparities are associated with race, ethnicity, gender, location, and socioeconomic status. What this means is people of certain races, ethnicities, and even locations have a better chance of getting better health care compared to those in locations lacking in that health care. Some groups have higher rates of certain diseases and deaths caused by these diseases compared to other groups. So why are health inequalities an issue? Well, there's the moral argument. It impedes social justice because it does not allow for an equal distribution of healthcare among all populations. It also limits the improvement of overall health in the nation. On top of this, it adds to de facto racism and classism due to the fact that populations of certain areas have better health care than populations of other areas. Because of that, it also perpetuates these inequalities among generations of people. Other issues regarding health inequities include the following. It impedes access to quality care for many areas and people, including those who are insured. As I said earlier, some areas have better health benefits than others. If you are insured and happen to live in an area with less benefits, it makes it more difficult for you to find a place with quality care. Another issue is the unnecessary costs. 30% of direct medical costs to minorities are excess due to these inequalities. This causes the economy to lose hundreds of billions of dollars each year. It also causes problems to ethnic minorities. These minorities tend to have higher mortality rates, chronic conditions, and poor health outcomes as compared to ethnic majorities. Health disparities vary among race, age, and sexual orientation. For example, among African Americans, they have a 20% chance of depression, 40% chance of stroke, and times 2 as likely to die as an infant compared to other races. Another example would be with LGBT health and aging, where more lesbians and gay men live in poverty compared to their heterosexual counterparts due to employment discrimination. How can health disparities be reduced? In order to reduce health disparities, it's important to ensure focus on communities with the greatest need, support research that helps identify and deal with health disparities, standardize and collect data to better address disparities, increase opportunity for disparity populations to work with community members and prevention members. Partner with local resources and programs to ensure employees can identify and use reliable health information. This is a health equity infographic that covers the programs and strategies being used to ensure equal health opportunities among populations. For example, they have programs for case management and home visits by community health workers, for decreased asthma-related hospitalizations for Black and Hispanic children, and expanded vaccination recommendations, and some health disparities in hepatitis A disease for other racial minority groups.